Wisconsin, as in some other states in this country, nursing assistants are allowed by law to apply certain medications to the skin. Hi, I'm Kathy Getrist, and today we're going to be talking about topical applications of medication to the skin. These medications are called topical medications because they are used on top of the skin. Today's discussion is going to cover the important information that you need to know in order to apply these medications to the skin safely and accurately. Well, why would topical medications be used on the skin to begin with? There's a number of reasons why topical medications are used. The first might be to soften and destroy the outer layer of the skin so that it can shed. An example that you might be aware of is the use of compound W or other medications such as that to remove outer layers of skin for folks that have corns and calluses on their feet. Another might be to protect the skin. The medication does not penetrate through the skin layers or soften it, but instead it forms a long-lasting film on the skin. This film protects the skin from moisture and germs. Sometimes you'll see that used in a long-term care facility where you have residents that are incontinent of urine and stool, and there's a hazard of the skin breaking down when those waste products getting direct contact with the skin. So after cleaning the perineal and rectal area thoroughly with soap and water and dried, this film is sprayed on to the skin, and when the person is incontinent, then it cannot go through to the skin layers. Another reason for applying topical medication might be to relieve itching. Itching might be caused by inflammation. For example, you're probably knowledgeable about the medication calamine lotion that's used for itching for things like poison ivy. Another use is to reduce inflammation. Inflammation can be reduced by suppressing the body's natural reaction to inflammation. Something like hydrocortisone cream that's used for the treatment of bug bites. Another reason for using a topical medication would be to reduce the growth of microorganisms, any kind of germ on the skin. Alcohol or povidone iodine, you're maybe more familiar with its name called betadine. Those products may be placed on the skin to disinfect and to clean the skin. Sometimes if a patient is going for hip surgery, they'll have a cleansing medicated wash to the skin prior to that surgery. Also, topical medication might be applied to reduce pain by numbing the skin layers. Solar cane is an example of that can be applied to the skin for a severe sunburn. Also, you might have medication applied for the use of killing insect parasites that infest the skin. An example might be the use of Quell shampoo for someone that has head lice because it can kill the head lice parasites. There are two effects of the use of drugs on the skin. One is a local effect. Local means that it does not enter the bloodstream and go to other parts of the body. It stays right on the skin. Few drugs actually that are applied to the skin are intended to go into the deeper layers. Most of them are applied for a local effect. They remain local and are restricted to the skin surface itself. Another effect of the drug, however, might be a systemic effect, and that's where there is absorption of the drug through the skin and into the bloodstream, and then it travels to all parts of the body. Drugs for the skin are prepared in various forms. The form that is chosen for a topically administered drug depends on the desired therapeutic effect. There can be creams, lotions, ointments, aerosol sprays, foam medications, or pastes. Skin patches are another relatively new, well, within the last 5 to 10 years, I should say, whereby medication is being administered with a patch that's placed on the skin. In the past, taking medication by mouth was the only way of taking something orally. Now they're available in what's called a transdermal patch form. And the patch is an easy and convenient way to take medications, particularly for individuals who have difficulty taking medication by mouth. A Nicoderm patch that you may be familiar with to help decrease the craving for cigarettes would be an example of a type of transdermal patch. Applying or removing any of these patches is the responsibility of the nurse. However, if you notice that a patch is falling off, or if a patient is complaining of burning or itching underneath the patch, you would certainly want to report that immediately. Preparing and administering topical medications requires your full attention. The 5 rights is a traditional checklist that for years has helped ensure accuracy in drug administration. I'd like to review those 5 rights with you. First, and probably most of all, you want to make sure that you have the right patient. That means check the identification bracelet, and if you are unfamiliar with the patient, ask them to pronounce their name if you know that they can do so responsibly. If the patient asks questions about the medication, be sure that you recheck prior to progressing. Maybe they know that this is not a medication that they have taken in the past. Might be a clue that you might have the wrong patient. The second right is the right drug. If the nurse asks you to apply vitamin A and D ointment, it's your responsibility to read the label on the container to confirm that in fact you do have that correct medication. If there is no name on the container that you are asked to use, you may not use it, and you'd want to report that. The third right is the right time. If it's ordered to be applied at a certain time, for example, before bathing or at bedtime, be certain that you are adhering to the exact time that has been indicated. The fourth is the right dose. If you've been asked to spread this medication over the entire leg, that means that you need to make certain that you not only apply the medication in the front of the leg, but as well on the back of the leg and in all of the folds of the skin. Allow only a thin layer to be placed on the skin. More is not better when you're applying medication, so you would not want to apply a thick layer. Finally, you need to have the right location or the right route. And make sure that it is on the patient's skin in the right place. Read the directions carefully. Make sure that you know exactly how it's to be used. Many of these applications to the skin need to be shaken before they can be used. Some need to be inverted upside down. All of those instructions will be carefully written out on the directions. So look at those before applying any of these. You will be applying medication to unopened, intact skin. By law in the state of Wisconsin, you are only permitted to do this. You may not apply medication to cut or another form of open skin. The reason why that's so important is because if the skin is open, It allows medication to get into the deeper layers, into the bloodstream, and can go to all areas of the body. Do not apply medications to mucous membranes. Mucous membranes make up the linings of the body openings such as the mouth, the eyes, and the rectum. Unlike the skin, mucous membranes don't have a tough outer layer of dead skin to protect the underlying tissues. Instead, their surfaces are moist and easily penetrated. Medication absorption through mucous membranes is rapid. Nitroglycerin is an example of that. If you recall, sometimes patients who have chest pain need to take quickly a nitroglycerin. It's placed in their mouth, underneath their tongue, against those mucous membranes, and where they rapidly get into the bloodstream. Never apply skin medication to mucous membranes, as this can cause over-medicating or other harm to the individual. Be certain to report your observations. Note the appearance of the skin with each application. Has there been a change for better or worse by the use of this medication? Has there been any change at all? Maybe if there is no change at all, the medication is not working, and that too you would want to be sure to report. Are there any signs of irritation on the skin caused by this medication? Could be redness, swelling, maybe warmth, or pain. Note also any medication sensitivity, such as rashes, dryness, ruptures of surface blood vessels, or any itching that the patient might be experiencing, and report any and all of those. People who have chronic skin conditions need emotional support. Living with constant itching or pain is a very stressful thing. They may lose sleep because they are so uncomfortable, and they might become depressed over their condition. Especially this is true for folks that have a condition that is chronic and a lifetime. Patients with skin conditions such as psoriasis, I don't know how familiar you might be with that skin condition, but there's a lot of scaling and itchiness to that. Also very unsightly patches that are on all surfaces of the skin, can be on the face, the scalp, the hands, the arms, legs, and can cause a lot of distress. And frequently people with severe skin conditions such as that need to have some special counseling. Acne is another thing, particularly on the face, that can be distressing and cause emotional troubles for young people who have body image issues that are so important at that time in their young adult years. So show support by accepting their feelings and respond to their needs with patience and understanding. Prior to applying any medication to the skin, you want to be certain to wash your hands as you do with any other procedure, but in addition you would want to wash the skin area that you're going to be applying this medication to with soap and water, and then rinsing it well and drying it. Whenever you're applying any medication to the skin, you will want to be wearing gloves to be sure that this medication is not going to be remaining on your skin. Creams need to be rubbed gently into the skin by hand. Lotions tend to be thinner than most other kinds of medications that are applied to the skin, and as a result need to be patted onto the skin by use of a 2x2 gauze or a cotton ball. Ointments are to be applied with a cotton-tipped applicator or a tongue blade. To remove ointment from a jar without contaminating its contents, you would want to place the cap upside down on a clean surface and remove the amount desired using an applicator or tongue blade. Never dip in and out using the same applicator. Administer the medication from the center outward, never going back over the skin after the application. Be sure the skin surface is completely dry before applying powder. Fully spread apart any skin folds, such as between the toes or under the arms, before applying, so that it can be distributed evenly. Turn the patient's head to the side to avoid their breathing in any of the powder particles. Aerosol sprays need to be shaken vigorously prior to their use. Spray the area from a distance of about 3 to 6 inches. Direct the spray away from the face and be sure to try to apply it evenly to the skin. A foam medication also needs to be shaken vigorously prior to its use. The can is then inverted and you spray it into your hand or directly onto the skin. For using a paste, you first of all need to puncture the tube by inverting the cap back into the tube. And once the paste container is punctured, then you can squeeze the paste onto an applicator and apply it onto the skin in that fashion. Disposal of your supplies, such as tongue blades, applicators, cotton balls, and so forth, need to be done in an appropriate waste container. Never leave your items lying around on the bedside stand or other area close to where your patients might be. And also be sure that you're putting away all of these medications, and finally wash your hands when you're completed with all of it. As a nursing assistant, you may be expected to use medicated shampoo as well. This might be used as part of routine hair care for an individual. Physician's order need to be obtained for use of medicated shampoos. There are various types of medicated shampoos that are used depending on the patient's problem. If the individual has, for example, psoriasis, they may have one kind of medication. Dandruff calls for another. Head lice is still another. Medicated shampoos have very strong chemicals in them, so you would want to be very careful to protect the patient's eyes when doing this by use of a washcloth. Usually these medicated shampoos are stored in a locked cupboard and also tightly capped between use, to be sure that some individual who might be confused wouldn't be able to get them and drink it. Read the directions very carefully. For example, some need to be shaken well before their use. Some need to stay on the scalp for a period of 5 to 10 minutes. So be certain that you know exactly how this medicated shampoo is to be used effectively. I'd like you also to refer to the student manual that you're currently using, to the pages that follow this outline for additional information that's provided about the use of medicated shampoo. Medicated baths is also a treatment that you may assist with. The medications that you might be used in a bath could be coal tar, saline or salt solution. Oatmeal might be applied to a medicated bath. Sodium bicarbonate, which is common baking soda. Or rubbing alcohol might be added to water and providing some help to the individual. All these things have specific ways in which they benefit. Some help lower temperature, as with the rubbing alcohol. Some of the other products, like the coal tar, is used for psoriasis to help decrease the itching and so forth that go with that. For any of these products that you use, the procedure for giving this bath need to be followed very carefully. First of all, you'd want to clean the tub extremely well before the individual gets into it. The patient should soak in the tub usually about 20 or 30 minutes unless you've been given other specific orders by the nurse. The person's body should be covered as much as it can be in order for the medicated water to be most effective. Once the bath is completed, you would want to pat their skin dry as opposed to rubbing it vigorously, so that not only the medication can stay on, but that you're not causing any additional discomfort to the individual. Clean the tub thoroughly after it's used, particularly if you can think if you were having a product such as coal tar in the tub, it leaves a real scum and ring around the tub that needs to be aggressively removed prior to its use by someone else. Use extra precautions, as these medications can make the tub especially slippery also. So be careful when you're getting them in and out of the tub and assist them as needed. Now I'd like you to watch a demonstration of applying a topical medication to the skin. Wash your hands and obtain the supplies. Identify the patient and explain the procedure. Check the 5 rights: the right patient, the right medication, the right time, the right route, and the right dose. Provide for privacy. Position the patient so the area of application is accessible. Observe the appearance of the skin. Apply an underpad protector. Cleanse the skin with soap and water or as directed by the nurse. To apply the medication, don your gloves. Open the container and place the cover upside down on a clean surface. Dip the tongue blade into the container once. Try to dip out the entire amount needed for one application. Use a light stroke with the tongue blade. Apply a thin layer. If more medication is needed, use the other end of the tongue blade or a new one. Remove your gloves. Dispose of the supplies in the appropriate place. Assist the patient to a comfortable position. Put away the medication, wash your hands, and report any observations to the nurse.